Okay, so let's go to the main topic. So I think before we can define what is how to reverse the aging, let's talk about what the aging really means. I know we all say, yeah, we got old and this and that, but what's really, in scientific language, what does it really mean? So aging is the effect of time on the human body, and it occurs on multiple levels, and you can see the pictures. So there's the first phase, or one of the part of the aging is cellular aging. The cells, they become old. So cells age based on the number of times they have replicated. A cell can replicate about 50 times before the genetic material is no longer able to be copied accurately. So the first 50 times it can, just like your ink toner in the printer, you can refill it, up to a certain extent. After that, you have to buy a new one, right? So the same thing with the cells. They will, up to 50 times, they will be fine. After that, they don't not be 100%, and that's where it comes in. The more damage done to the cells by free radicals, we're going to talk about that in a few minutes, the more cells need to replicate. So that means let's say if you get 50 replicate, you want to use them less often. The more damage you do to your cells, the faster you're going to come to your 50 replication point, and after that, the copies of replication would not be very healthy. So that means you can slow down the process of cellular aging, not getting yourself into bad situations by exposing yourself to free radicals. The second one is hormonal aging. The hormones change, and you can see this. You can see right here, the estrogen is dropping, progesterone, the female hormones, testosterone and DHEA, all main hormones are dropping with the passage of time, and generally the most decline is happening here around at age 50. You can see all that. So, so that by itself has on the way we function. The accumulating aging, that means that's your external aging. That's we go to spas and everything. That's exposure to toxins, the sun, the harmful food, pollution, smoke, and they can cause to your external part of your body. Metabolic aging. So cells are constantly turning food into energy, which produces byproducts that can be harmful. So the process of metabolizing and creating energy results in damage to the body over time. So we are mortal, and there's a mortality is due to all those 4 reasons. So one of the very important factors so far in the research, we have found that calorie restriction slows aging in human beings. So that's a perfect food right there. So I know a lot of there's a discussion on the TVs about superfoods. Dr. Oz has been talking about it, and then antioxidants and free radicals. So let's talk about that briefly so we know this concept. So the free radical theory of aging, FRTA, states that organisms age because cell accumulates free radical damage over time. So kind of like, these pictures you can see, these are like free radicals, they're attacking the cells. So if we can prevent free radical formation, then we can probably live longer and stay healthy for a longer period of time. So then comes in the antioxidant. So basically we're oxidizing cells, and because of that we produce free radicals which cause damage to the cells, and hence we age. So that means if we can use antioxidant, then this aging could slow down. We can prevent formation of free radicals. So and that's how the superfoods comes in. The superfoods have antioxidants and all the other stuff. So these antioxidants are available in supplements. So vitamin A, C, E, and then lutein and beta carotene and lycopene. These are the few of the example of antioxidants. You can take supplements, or they can be available in the food. You can find the food which have those things in there, and they're supposedly help your aging process. The thing is, this is still a kind of like a controversial concept. The second is hormone replacement, and it's pretty common nowadays. I mean, estrogen replacement for postmenopausal females, or testosterone replacement for male. So you can see here, hot flushes, vaginal dryness, other symptoms of menopause. So after the hormone replacement, they're less tired. And you see this, she's getting the hormone replacement, and this guy's very happy.
I think it's the other way around.
It is a possibility right there. Now, it increases the risk of breast and ovarian cancer, and he's still very happy. I don't know how much to say this. I'm just kidding. They're both very happy. Yeah. So it has risk and benefits. So just there's no silver bullet. So they say if you have to open it to eat it, you shouldn't be eating it, like all the box foods or canned food. Don't smoke. We all know smoking is bad. It does actually accelerate your aging process. Exercise, even 15 minutes a day, will slow down your aging process. They say socialize. And I don't know if it is social media socialization or other one. It was not clear to me. But socialize for one way or the other, Good amount of sleep, that's important. People who don't sleep well, they're always tired and they age fast. So, and again, question is like why they're not sleeping. It could be pain. So the management of the sleep or insomnia would be management of pain, actually, not just trying to put people to anesthesia, like Michael Jackson did, but treat the underlying cause. And stress by itself is, accelerate the aging process. I don't think, we can achieve all those goals. The society we live in is very difficult to get all that done. But few of those things, I think, besides the stress, we can get everything else, I guess. So there's a concept about the stem cell. So as I said, the topic of discussion today was a little bit more advanced technology, and not about the conventional hormonal replacement. We have talked that in the past. And also, the medical spa stuff like Juvederm or liposuction and other, medical procedure for like cosmetic surgery. We're not talking about that. That's basic. That's old-fashioned. It's not really fancy anymore. The difference between a regular cell and the stem cell is that it can keep growing. It doesn't stop like other cells which stop at a certain level, and then they can differentiate. They're like raw material. They can differentiate into any kind of body parts, like heart cells, liver cells, kidney cells. Under the right environment. Now let's go to this FDA thing. So FDA started cracking down. So what happened is that when this study came out, there was no regulation. A lot of clinics started to open up, especially in Florida and Beverly Hills and everywhere else. And they were claiming, oh, we're going to give you stem cell transfusion. It will cost you $20,000 and stuff like that. So there was the FDA got involved and started to crack down those clinics. They got shut down, which is good. Because that's the way it's supposed to be. Because we don't know what's the impact of side effects on the bigger scale, because the studies are not there yet to support the whole thing. But the other countries, they start to make money out of it, right? They start to do and you can see there's a few clinics. I was searching on internet where they are. Germany, Austria, Lebanon, Philippines, again Germany, China, Germany, Ukraine, Tijuana, Mexico, China, Beijing. So there are stem cell clinics. So what they do, they bring you in, just like a medical tourism. They give you, the whole kabam, like pre-op and everything. It's pretty expensive though. So again, it's not clear yet if there's any advantage at this point. So it's experimental. But what is real, I'm going to show you. The thing is, can we make new body parts? Well, the other treatment is like where you're actually treating the whole patient as, you're infusing something and they're supposedly changing into younger people. That's what it is. Happening in other countries, not here yet. So, well, we can stick with the portion of it. We can make just body parts, right? What do you think? So, let's see if that's possible. Oh, yeah, if you have a 3D printer, you can do it. See that?